What is the protozoan that causes trichomoniasis? Imagine a tiny organism causing a common but often overlooked sexually transmitted infection. That organism is called Trichomonas vaginalis, a single-celled parasite that leads to trichomoniasis. This parasite is a flagellated protozoan, which means it moves using whip-like structures called flagella. It prefers environments with little or no oxygen, making the human urogenital tract its ideal home. Trichomonas vaginalis is the most common pathogenic protozoan, infecting humans in many developed countries, and causes millions of new infections worldwide each year. This parasite mainly lives in the vagina, urethra, and prostate. It reproduces by simple division, so it doesn't form a protective cyst like some other parasites. It also doesn't survive well outside the human body, so transmission usually happens through direct sexual contact. Most often, it is spread during vaginal intercourse, but it can also be transmitted through other forms of sexual activity involving contact with infected tissues. In women, trichomoniasis can cause symptoms such as a frothy, yellow-green vaginal discharge with a strong odor, itching, irritation, and sometimes pain during urination or sex. However, many women may not notice symptoms at all. Men often have no symptoms, but when they do, it can include irritation inside the penis, mild discharge, or a burning feeling after urination. Because many cases are asymptomatic, the infection can go unnoticed and be unknowingly passed to others. Trichomoniasis is more than just an uncomfortable infection. It can increase the risk of acquiring other sexually transmitted infections, including HIV. It is also linked to pregnancy complications like premature birth and low birth weight. Fortunately, it is treatable and curable with prescription medications such as metronidazole or tinidazole. Using condoms consistently and correctly can help prevent its spread. From a sexual health perspective, understanding that trichomoniasis is common, especially since many people do not show symptoms, is important. Regular STI testing, open communication with partners, and seeking medical care if symptoms appear are essential steps to protect your health. Remember, self-diagnosis or unproven remedies are not reliable. Always consult a healthcare professional for proper diagnosis and treatment. Knowing about Trichomonas vaginalis and how trichomoniasis spreads empowers you to make informed choices about your sexual health. It highlights the importance of prevention, early detection, and treatment to reduce the spread of this infection and protect your overall well-being.